Right, good afternoon, everybody, and a very warm welcome to yet another SIOS webinar presentation brought to you by SIOS live this afternoon. A very warm welcome to all our members as well as visitors from across the world. We have members from all over the world that has tuned in this afternoon for this webinar presentation. It's indeed an honor and a pleasure for us to bring these webinars to you. It's a series of COVID-19 webinars brought to you by SIOS, this being the 8th webinar in the series, and what a great one it is going to be this afternoon, and the privilege and honor that we have to have the Chief Inspector, Mr. Tibozana, with us to do this presentation for us. Busy person, busy schedule, but we've managed to secure him today. Also, a record amount of attendees that have registered for this webinar today, so much so that it is also broadcasted live, streamed on YouTube. So if any one of your colleagues perhaps contact you and say that they cannot get access into the Zoom room because the capacity is filled, please just tell them to visit the SIOS YouTube page. It's busy being broadcasted live on there. So quite a historic day for SIOS and for us, for the safety fraternity. So we're looking forward to this one. My name is Niels Norkier. I am the CEO of SIOS. SIOS is the South African Institute of Occupational Safety and Health, a SACWA recognized professional body to register and to recognize professional health and safety practitioners in South Africa. We currently have 3 professional designations that are registered on the NQF, namely technical member, graduate member, and chartered member. So welcome to all our professionally registered members this afternoon as well. Just for our SIOS members, please note that this webinar has been CPD verified by SIOS. Members know how to claim these CPD points. After the webinar, you can visit the SIOS website and log into your profile, and you can claim the 2 CPD points for attending this webinar today. If you have not as yet claimed CPD points as a SIOS member, please go to the professional registration page on the SIOS website. There's a drop-down tab that tells you all about CPD. There's even a video tutorial to show you how to upload your CPD points. So please feel free after this webinar, SIOS members, to log into your profile and claim your 2 CPD points for attending this webinar session this afternoon. Just some housekeeping announcements before we start the webinar. Please note that at the bottom is a Q&A button, a question and answer button. The Chief Inspector kindly agreed that he will field some questions afterwards. You can imagine with over 1,100 persons that registered for this webinar this afternoon, there's going to be literally thousands of questions. We will do our utmost best to collate the questions. We've got our expert Garth Hunter in the background, a chartered member of SIOS, registered occupational hygienist, who will go through the questions and field them afterwards for a Q&A session. Please note to not post your questions and answers in the chat box. We will not be able to field any questions in the chat box or the chat icon. The chat icon is there to meet and greet, like I see most of you are doing. And therefore, please can you use the chat box to meet and greet or to post any technical questions that you might have, for example, sound, visual questions, etc. And we've got our communications and membership manager in the background as well, Gareth, which will do his utmost best to help you and assist you and send you a message with regards to that it's and how to assist you with that. We can confirm that the sound is working. The video is working and everything is working fine at this stage. So if you might have any sound problems, please check your sound and please check your video from your side. Right. This webinar, like with the previous 7 webinars, will be recorded. It's actually being recorded as we talk now. It's also recorded live on YouTube. So both the recording of this webinar as well as the presentation will be made available to our members directly after or as soon as possible directly after this presentation, normally within 24 hours. Members of SIOS will receive an email sent to them directly with the recording link, as well as a link to the presentation. The presentations for the public is also posted on our Facebook page. All 7 of the previous ones are there on our Facebook page. as well as on our website latest news page. So that is open to the public to view as well. But members, as per usual, you'll get an email with the recording as well. I also note from the previous webinars, there's lots of people asking for certificates. No, this is not a training course per se. There's no certificate being issued. The way that you demonstrate that you've attended this webinar is for SIOS members is to go and claim your 2 CPD points on your profile. Talking about recordings of webinars, if you've missed any of the previous webinars, yes, all 7 of them are available on our website as well as our Facebook page. Right, now, moving on to today's webinar presentation. As I indicated in the beginning, we are indeed honored and pleased to have the Department of Employment and Labour's Chief Inspector for Occupational Health and Safety with us this afternoon. While I sincerely hope that the technology is not failing us, because he should be in the background there. The Chief Inspector, Mr. Tibozana, got an impressive bio, which I'm not going to read out other than his title, which is Chief Inspector of Occupational Health and Safety. As you all know, we received some guidelines from the department before, right in the beginning in April. We received a direction on, I think, the 29th of April. And then we finally received the consolidated direction, which was published on the 4th of June. And this is why Mr. Zana is here this afternoon to take us over this presentation of his. Will highlight the difference between the previous direction and this one, and also hopefully to answer some of your pertinent questions at the end of this session. Mr. Zana, if I can please ask to put your camera on right now, as well as your sound, and also share your screen with us, and hopefully technology will be on our side and we can see you and hear you and also view your presentation. Thank you very much.
Thank you, Mr. Nokia, and thank you for the opportunity to you and SIOS. We do appreciate it. The opportunity, of course, it comes in a grave period in the history of our country as well as globally. To talk about the second direction is an absolute honor for me, and also the opportunity is appreciated by the department. With that, I'm going to go into the presentation then. So the presentation, while there are a number of slides that I've included, a number of these slides, I'll pass over them because they would be common knowledge. Today I'll share both what the new direction talks about that was published on the 4th of June, but I'll also give some experiences that we've had since the 27th of March and the ongoing struggle that persists in the industry at large. So the direction then, as I've indicated, we will talk to these issues. The 4th of June direction, of course, supersedes the 29th of April one. The presentation, in terms of the directions that were published, there were some interesting changes that have been introduced that have far-reaching implications for the industry in general. And we'll cover those in a bit more detail during the course of the presentation. Some of the information here that I've included is more for people to read over in their own time. I'll just touch on a couple of things that I think is more critical. Your direction touches on sector-specific measures, and that is quite important, that there will be sectoral guidelines that are coming out in relation to the directions that have been published. Those directions will also go through a tripartite structure, that being government, labour, and obviously business. So it is important to note that with the publication of these directions, the current legislation is still applicable. It does not fall away. So that is very, very important that people realize that the OHS Act and its relevant regulations are still applicable. Something that I have to emphasize is that the OHS legislation requires the employer to provide and maintain as far as is reasonably practicable. And that is probably one of the big needles that will be running through the directions. What will be deemed to be reasonably practicable? A working environment that is safe and without risk to the health of workers, and to take such steps as may be reasonably practicable. And it's important to note, to eliminate or mitigate the hazard or potential hazard. So there's something that is in existence or something that could take place. And if an inspector was to visit your workplace, this is what they'll be looking at. Let's just remember the silver lining that runs through the legislation is always what the employer has done and is doing to maintain a healthy and safe environment. And you'll note that what I've quoted there is Section 8, or part of it anyway, so that you can be reminded when we go through this direction what exactly the linkage is in terms of the HS Act. The application is very, very important. And when you looked at the first direction, the application included the healthcare sector, which was one of the sore points. And when we cover the application in terms of the second direction, you'll see also how that had changes in relation to this. So what was included and what was excluded. The exclusion, of course, then was Section 1.3, which dealt with DMR or mine-related issues, and then maritime-related issues, which is what you'll pick up there. The medical and healthcare services was also something that was largely excluded, albeit that in the case of the healthcare sector, the hazardous biological agents regulation was applicable still. And then, of course, where other ministers of government issue any directives in relation to health and safety, those will be excluded from the administration of the occupational health and safety inspectors in the Department of Employment and Labour. Just a brief history then, or timeline if you like. You'll recall that there was a guideline that was published around about the 15th of March, and I say round about because some people are quoting both the 15th and the 17th. It's not very relevant. It was published. And then the guideline, it should be noted, was a precursor to the first and second directions that were published. And of course, I remind you that the biological agents regulations were in place. Let's just take a slight step. I'm not going to go into the broader global history. Suffice it to say that this was the steps that were followed between the SARS-CoV-2, that is the virus, and the establishment, if I can use those words, of the disease, surfaced around about November, December, and when that took place exactly is irrelevant in my opinion. It is here with us. The announcement that it had become a pandemic in South Africa took place around about 11 March. The disease then was first announced as a public health emergency of international concern on the 30th of January 2020 by the World Health Organization. And then our first case was the 5th of March in South Africa. Then the Department of Employment and Labour published its guideline with that title, and as indicated several times now, there were notifications around directions that were published, and there's some historical information for those who are interested. Just so that you're aware, again, I'm going to just repeat myself on this. The NEDLAG, which forms part and is an entity of the Department of Employment and Labour, and an important body within the broader legislative framework in South Africa, was involved in the development of the directions, both directions that were drafted and eventually accepted and published, or approved and published, if you like. What is it then that we are going to look at that is so critical, and which I'll discuss when we get there in more detail? The Department of Health is excluded from the direction in terms of them not being inspected or not complying with the directions. So by the very essence then is that they are included in the direction, as opposed to the first direction that was published. The need to wash and iron cloth masks, we'll touch on that. The tests on the return to work, that is a second test after the first one was done. And then a very important one is that employees may now leave work where there is a real threat, and we'll go into a bit of detail now. I touch on, in some cases, the detail because it's important, and these questions are popping up all the time. And I'm hoping that the members that are here, or anyone that is here on this webinar, is in fact taking note of the issues that will arise so that we can pass on the right messages going forward. Inspections in the past then for the inspector was relatively new, and of course there were some issues and some groundbreaking issues that was put in place by the inspectors as we went along. For example, disinfecting the whole workplace, closing workplaces. In the beginning, these were issues that were quite problematic, and employers raised them on a continuous basis. The employers had nothing or very little in place, and you'll recall that this was due to the global challenge of having various things such as sanitizers and so on, masks in place. Inspectors had to learn how to apply the direction, which was very, very important, because if we made mistakes, there would be a challenge that infection could continue. The inspector's work is going to be about trying to contain the spread of the disease. That is one of their primary issues that they are focusing all the energies on. The challenge started to increase as time went on for the Department of Health and the application of the regulations in terms of healthcare facilities. Of course, the big debate was, how do we close hospitals and other healthcare facilities, both private and public, when these are the very facilities that are supposed to be looking after people? And of course, the argument is these are also workers, and they must obviously be protected, because you cannot have an environment which is further going to infect people as well as workers at the workplace. So this was a big issue, and there were some legal challenges around that as well. But inspectors operate without fear or favor and need to do the work, even if we are trying to find our feet and we make errors along the way as we go along. So your argument could be, why make errors and so on? This was a totally new thing. We needed obviously to ensure inspectors were equally protected, as well as us trying to allay the fears of the inspectors going out, because they too were worried about becoming infected as well as infecting their families. So these were just some of the things that we had to face as an employer. Inspections then in the present have changed. In the beginning, it was all about, have you as an employer got things in place? Of course, there were far less employers under lockdown 5 that were open. Us, on the other hand, as inspectors, we were not allowed to lock down. We were considered essential, and the inspectors were sent out to make sure employees are complying in order to immediately try and effect as much containment as possible. So your inspectors are experienced, and they're in a better place to deal with the application of the legislation and the direction, of course. The challenge with employers who have high volume traffic and the application of the legislation remains one of the biggest challenges we have, and would be a hotspot for ensuring that contamination continues. And employers, you will see in this direction, have got a responsibility to those who are visiting their workplaces, no matter who they are, whether it's public or private, they have a responsibility. Most inspections that we have done, more than 70%, have been in the high volume areas around the retail and wholesale sector, as well as various government departments in relation to people visiting their workplaces. This probably remains a challenge in that you cannot see the virus. You will be exposed to the virus, and that virus will leave wherever you are will leave with you if the employer hasn't done what is required, or the workers, as you'll see, haven't done what is required. So a quick one, of the work that we've done, 15% have been in the government sector. A lot of the workplaces in the government sector have been closed, but there were a couple that were open. 85% then have been in the general sector, and your compliance rate varies between public and government sector from 47% to 57% compliance rate, which is obviously horrific or horrifying, in that we are looking to contain this, and those figures don't talk to confinement or containment. So your retail and wholesale sector then at over 70%, and falling in second and third place was your agriculture and manufacturing sectors in terms of the top three sectors that we have visited. More than 600 inspections have been done in your government sector. So these are not the only sectors then that we have visited. There are others that we have also been at, and where we have done work. So the purpose then of the directive, because it's important, if you don't understand the purpose, that you don't know what the intention of this directive is. So it is about containment. But let's have a look at the detail then. The purpose of the directive then is to stipulate measures that must be taken by employers, a Section 8 component, if you like, in order to what? To protect health and safety of workers and members of the public who enter their workplaces or are exposed to their working activities. And you'll see this comes up in the direction where it also provides you with information as to what you should be doing to contain the virus or to curtail it. So the direction then addresses two key issues: the transmission by an infected person to workers in the workplace, and transmission of the virus by members of the workplace to members of the public, as well as from members of the public to the rest of your workforce. Of course, this is why it's important for an employer to manage the workplace in such a way that they're managing what's going out and what's coming in relation to the work, in relation to COVID-19. So our main concern then is, how is the community infection taking place versus the workplace cross infections, if you like. Community infection in terms of reporting of cases to the Department of Employment and Labour is different to the type of reporting that will take place to the Department of Health. So if you have a workplace infection where someone at the workplace infects someone else at the workplace, that becomes a work-related infection and therefore must be reported to the inspectors as well as to the compensation fund. And that is important, and we'll touch on that again a little later. So your community infection is not something that you'll report to the compensation fund or necessarily to the Department of Employment and Labour inspectors. But the Department of Health has got a vested interest. Remember, public health is an issue that the Department of Health focuses on, and therefore whatever happens in that space is for them to address. One of the big issues then, and this is something that has come up as a non-compliance issue from the beginning up until today as we talk, this is a big issue that is impacting on us. You would imagine that since the application or the introduction of our first act in 1918, we are still talking 4 acts later to the issue of risk assessments at the workplace. We all know the importance of risk assessments. There are highly complex risk assessments out there, or methodologies, if you like, versus those that are so simple that children can work with them. However, the application of these things at the workplace, my question is at this stage, how are employers complying with COVID-19 and the direction in relation to the directions when they haven't even got a risk assessment in place. And according to the directions, it forms the basis for a plan and how they're going to manage and monitor what is taking place at the workplace. So the object of conducting or updating a risk assessment, and here we are talking specifically in relation to COVID-19, is to provide a specific focus on COVID-19, and it's clearly stated in the direction, and then to adapt the measures required by the directive to specific working environments. So the working environments are going to look at what the risk assessment has said must be in place. And of course, you are going to use people that are competent to be able to do the necessary adjustment to your risk assessment as required. Otherwise, your measures that are going to be proposed and that you're going to apply won't be the right type of measures. So the directive then is based on infection transmission prevention. That must be clearly understood, transmission prevention. When we talk about containment, this is what we are talking about, as well as the following point, and specific occupational hygiene practices. What are those practices? And by the look of most of the members that are gathered here, you understand what those issues are, and they're also captured in the direction in detail for you to be able to follow up on. They focus on the need for employers to implement measures to either reduce, that is mitigate, or eliminate the transmission of the virus in the workplace. If there's nothing else you take away today, this is the most important slide that we are referring to, where it says that infection transmission prevention is what we are trying to implement and make everyone aware of at the workplace. Everything we do drives towards infection transmission prevention, as well as by having that as something we have to do, we have to then focus on how we're going to go about doing that, which means the application of occupational hygiene practices, amongst other things that you may determine as critical. So for you to note then, this directive recognizes that there are sectoral specific measures which I've touched on, which will be the sectoral guidelines. The directive does not reduce existing obligations, and I'm repeating myself in terms of the Occupational Health and Safety Act. That must be foremost in your mind. Nor does it prevent an employer from implementing more stringent measures. So even if you put in place the sectoral guidelines, which seeks to be sector specific, and I'll give you an example of this. If you are in an administrative environment and you're wearing a cloth mask, and you go into a work environment where there are chemicals, you're not going to be wearing a cloth mask in that type of environment. You're going to determine the most appropriate respirator to use within that environment to ensure that your worker is adequately protected. And should it be required that you implement something far more stringent than what is proposed, it is to your advantage because you will obviously be looking after an important asset at your workplace, that being your worker. Now, one of the important things is, while we are putting these things in place, it is important to note that the directions will expire at some stage. And at this stage, I've spoken to my directors that we look at any sectoral guideline that comes out as being something that we might turn into something in terms of section 11 and 12, which deals with listed work. It's something that I've been harping on for quite a while now, that we need to get something in terms of listed work, for example, in the construction industry. What the listed work issue is generally about is sectoral determination, such as you have in the BCA and so on. I'm looking at that from a health and safety point. This has been there for the last 20 odd plus years, and nobody has effected anything in relation to this, despite us having very poor compliance rates in various sectors. But more so, the high risk sectors are of big concern to me. So your big issue that I'm going to raise with you today is going to be that in the future, listed work will be published and will be covering your high risk sectors. So if you look at 29 April, then we've excluded the following issues, and any direction that's issued by another minister, as I've indicated, will apply for them in that sector, and not necessarily something that we will enforce as the Department of Employment and Labour. Simply put, the mining sector, their minister has introduced something, so we are not going to get involved there. Your maritime sector, if there's nothing there in terms of health and safety around COVID, we most likely can get involved there in terms of what the direction authorizes, unless SAMSA, the South African Maritime Safety Authority, introduces something, in which case, if they do, we won't get involved. So I'm going to move on from this, and then I'm going to start touching on some of the key things that you need to take note of. One of them is the definition of a vulnerable employee. And there's been quite a bit of activity around vulnerable employee. But if I told you of the number of complaints I'm getting where employers are ignoring workers in relation to this specific definition, and where it appears in the direction, we have a serious case for concern, because it means that we are going to have far more deaths than we have currently, and that will be directly related to employers not pursuing this particular issue. So what is a vulnerable employee? It means any employee as contemplated by the documents published by the Department of Health, insofar as it relates to those with known or disclosed health issues or comorbidities or any other condition that may place the employee at risk or at a higher risk of complications or death than other employees if they are infected with COVID-19. Now, when we talk about the more critical and more severe people that are on that list, if we are not looking at people that fall into these categories, then we are having a major disaster of great proportions on our hands, given that there are a number of people that employers are not trying to assist in this regard, and it will all be related to this definition that may place the employees at a higher risk of complication or death than other employees. That must be clearly understood. If your employer is not taking note of this and not doing something in this regard, the death rate will increase, if you like. Above the age of 60 years, who is at a higher risk of complications or death if infected. And this is these are scientific issues. If you're looking at the numbers around the world, this particular definition is not appearing as if it's a nice to have or what we would, we want to mess around with employers. That goes against the vision of the Department of Employment and Labour that seeks to make sure that employers are more productive in their working environment. So when you look at this direction, one of the key things that must be in your mind as well is the return to work. The return to work under level 3. Your question can be, well, then what about level 4 and 5? If you look at those, there are similar issues that have played itself out in terms of what employers were required to do. However, let's move to this. There were a lot more people that returned to work here. how were we going to assist them in relation to this direction. So plan for reopening workplaces, permission for workplaces in both the private and public sector to commence operating. Every employer commencing operations must undertake a risk assessment. And on the basis of that risk assessment, develop a plan outlining whatever measures he or she is required to take in order to ensure that the employees, when they return, are in fact will do so in a healthy and safe environment on entering the workplace. And this must happen, of course, before they return to work. So your question is, what about those that are at the workplace who have to now go in and clean? Those are obviously conditions that will have to be in place in order to make sure that the bigger part of the workforce is adequately protected. But your PPE then, for those people who will be going in, needs to obviously be sufficient for them to ensure that they are in a healthy and safe setup. So then, very important, the consultation issue, and I found that communication is probably one of the biggest problems that is taking place out there. Employers are not communicating with workers. And if they are communicating with workers, and please, I'm generalizing, but there are a number of employees out there from the type of communications over the last couple of days, 3 or 4 days, I've had like 400 WhatsApp messages come through to me in order to deal with workers that have various or a range of complaints in relation to what the employees are doing to them at their various workplaces. So consult with your employees on the risk assessment and the plan. And those that you are going to talk to will include any representative from a recognized trade union, any health and safety committee, the health and safety representative, or the employee representative, or all of them, if you like. So your big thing here is communicate with your staff, because by not doing so, the fear that is going to prevail at your workplace is going to impact on the safety and the health of workers in another way. Make that plan available then for inspection by the inspector and the persons noted above. The plan must include then that you have drafted. It must include the date the workplace will open and the hours of operation. It must provide a list of employees permitted to return to work and those that are required or may work from home, such as the vulnerable workers. Who are they? This question comes up time and again in terms of people that are 60 plus who ask me, can they go home? Can they, in terms of this legislation, if your worker can work from home, let them work from home. Obviously, you need to manage that issue. And while it may be easier said than done for me, as an employer representative, I'm required to ensure that the employees under me are gainfully employed, even if they are at home. A plan and a timetable for the phased-in return must be available. Identify vulnerable employees as indicated, and ways of minimizing the number of workers at the workplace at any one time. Try and see how you can contain this virus, prevent the spread of the virus any more than it is currently. Protective measures required to get the workplace ready, measures for the daily screening of everyone visiting the workplace, and we'll cover that screening issue later on. And then also the details of the COVID-19 compliance officer that you've appointed. And we'll touch on that in a couple of minutes too. The employer must phase the return of the employees to work in line with the plan. Don't have the guys coming in bulk and you know you can't handle it, or you don't have things in place, because you will be creating an environment that employees will get ill, and it will have another form of impact at your workplace. The last thing we want to do in terms of our act is have an employer charged with culpable homicide in relation to our act, which is there, by the way. You can read it up, for not for knowing that there are sick people at work, for knowing that there are people with comorbidities and other serious illnesses, and yet they allowed them to come back and did not adequately protect them with the measures that are prescribed here. So that is something for you to think about. How serious can this thing get in relation to the employer and the employer's involvement in not adequately protecting the worker? So to repeat then, the employer must phase the return of the employees to work in line with the plan. When we look at some of the administrative measures that have been noted, the employer must establish the following administrative measures. They must undertake a workplace, and I repeat something that you know that is happening out there. There are no workplace specific risk assessments. You cannot have a general risk assessment in such a manner that it has absolutely no linkage with your workplace, and especially in relation to COVID. Because you are going to be saying you must do certain things that another employer said they do by copying their risk assessment. And by not having that in your RA, it means that the inspector is going to take you to task. And this is all about giving meaning to the effect or effect to the minimum measures required. Take note, the minimum measures required at the workplace. How can you protect your worker? And again, I'll remind you of the issue of reasonably practicable. Using that issue to your advantage will backfire on you in relation to COVID-19, given the amount of information available and the availability of things unlike and as opposed to what was available at the beginning of this particular virus. Establish what the minimum issues are at your workplace. If the employer employs more than 500 employees, submit a record of your risk assessment and the written policy insofar, and this written policy also refers to Section 7 in the Act. But now, one of the questions you might have then is this more than 500 employees. If the 500 employees for one company is split up all over the country, do you still need to submit it? And the answer to that is yes. This section does not break it up for you sufficiently for you to submit, say no, you do not need to provide that information. So once I as an inspector establish that you have more than 500, my expectation is that there's a risk assessment that will be provided. So you'll submit this to your Health and Safety Committee and you'll submit it to the Department of Employment and Labour within 21 days of the commencement of this direction. So that 21 days post the 4th of June, then is the 25th. By the 25th of June, all this information has to be in by the Department of Employment and Labour if you are affected. Every employer must then take special measures to mitigate the risk, nothing new, to mitigate the risk of COVID-19 for vulnerable employees to facilitate their safe return to work or working from home. Take note of this. The safe return to work or the working from home. You have to mitigate the risk in relation to COVID-19. Notify all workers of the direction and how it will be implemented. And again, such as is the nature of law, we repeat ourselves as fathers do and mothers do with children in order to ensure that we get the type of action that we are required to get, given that people's lives are at stake here. Notify employees that are sick or have some symptoms that they must not come to work, but take paid sick leave. Notify employees that are sick or have symptoms, they must not come to work, but take sick leave. And in some cases, the employers are saying to the employees, if you tell your colleagues that you are positive, you will be fired. This is mind-blowing that is happening out there when you consider what this virus can do and how it can decimate your workforce as well as close your business if you do not protect your business. Now, the compliance officer is important for the following reasons. And here, this was something that was quite close to me. I'm horrified to know that the compliance officer function can quite readily go to a junior in your organization who cannot effect anything, any changes, has no authority to raise a point, and so on. So by appointing a manager as a compliance officer, and that is a significant manager, to oversee the implementation of the plan, to oversee the adherence to the health and safety measures established in the workplace, and here's probably one of the most critical things, to address employee or workplace representative concerns and to inform them and consult with the Health and Safety Committee. So this compliance officer has a very important task. And again, make sure that you're speaking to your employees, because I'm finding this one of the biggest problems currently with the amount of complaints coming through. Nobody's communicating with the workers. Every employer then must ensure measures required by the direction and its RA plan are complied with through monitoring and supervision. You saw that in the previous slide. It is being reported under clause 20.7 that the employer must do this. Minimize the number of workers at the workplace through rotation, staggering of working hours, and so on, in order to limit the spread of the virus within a congested workplace. Minimize contact between workers and members of the public, between one worker and another worker and members of the public and your workforce, for the reasons I've explained at the beginning of this presentation. If you want to succeed, if we are going to succeed as a country, you have an important role to play. Provide workers with information that raises awareness in any form and in any manner, and the direction goes on to explain methods in which you can do that. So then, let's deal with this important thing, because this is the biggest question that workers are having, because we are in that situation at the moment. You wouldn't have had this at the beginning, 27th of March and earlier. This is not what people were worried about. We were still trying to learn enough about the virus in order to put in place the necessary measures that would protect us. So at this stage, at that stage, we were still open-minded and trying to learn. Now we are saying, when the worker has been diagnosed with COVID-19, the employer must inform the Department of Health and the Department of Employment and Labour with regard to the compensation fund claim, as well as the inspectors that should investigate. The employer is required to investigate the mode of exposure, including control failures. So you'll find an inspector coming to the workplace and saying, where is your investigation report? We would like to see it. We're obviously there must be something that failed. There has to be a flaw in your systems in order for this virus to spread. Hear me carefully on this. This virus is not going to spread if we do what is required. We can contain it. So you're going to have to prove that you've investigated it. You're going to have to prove that you've got a risk assessment, even in the case of small employers. Despite this document speaking to a risk assessment not required later on, in terms of the Occupational Health and Safety Act, you will be required to have one anyway. To ensure that necessary controls and requirements are in place, determine the need to temporarily close the affected area. Now, I need to emphasize this issue. If you have someone that has tested positive, focus on the area that is affected. If this person had access on a daily basis, on a frequent basis throughout the day, Why on earth are you going to close your whole business and disinfect it? You need to look at a situation where you do a proper assessment of where the infection was prevalent and deal with that, and deal with it appropriately to prevent further spreading. We know the science of the virus, that it stays active, if you like, over a period of a couple of days. So if you are going to be there tomorrow in the infected area, you are more than likely going to pick the virus up. Determine the need to temporarily close the affected area for decontamination, and you can use whatever method will support you. But on disinfection and decontamination and so on, the Department of Health has issued guidelines. You don't need us to also publish guidelines, and 10,000 guidelines are published. You'll have a proliferation and you won't have time to do what you have to do. So in this case, go to the Department of Health website, get the information, and do what is required out of it. Give administrative support to any contact tracing measures. Here, the employer is required to assist the Department of Health in relation to contact tracing. Your inspector will not be doing that. The inspector of the Department of Employment and Labor in Health and Safety will not assist in contact tracing. This is a question I had, and yesterday I'm even answering phone calls on Saturdays and Sundays with regard to clients who are worried about their partners. Every employer must implement the following health and safety measures. Symptom screening. Now look at this. Every employer must implement the following health and safety measures. Symptom screening. Every employer must take measures to screen any worker when they report for work. Require workers to immediately inform the employer if they experience any of the symptoms while at work. Now, this leads me on to the other issue of, for example, if you are creating an environment in which there is fear, the worker will not come forward. And that is what is happening from the information I'm getting from the ground directly. Try and allay the fear of the workers. Tell them that we can beat this, but they need to follow certain precautionary measures. We can do this. We can do this. Do what you're required to do. Employers must comply with any guidelines issued by the Department of Health in respect of symptom screening. And here's an important point: where required, medical surveillance and testing. That is simple enough for you to understand. Going on to the next one then, and I won't go into the detail. If a worker presents with COVID-19 related symptoms, my question all the time is, what must I do? That is what the worker wants to know. That is what the worker wants to know. Allay their fear that this process can keep them in a healthy and safe environment. If a worker presents with COVID-19 related symptoms or advises the employer of these symptoms, the employer must not permit the workers to enter the workplace or report for work. And this is happening. In fact, senior managers are going to work walking around everyone at the workplace, in which workers are fully aware they are positive, yet they are walking there. If the worker is already at work, immediately isolate the worker, provide the worker with a surgical mask, arrange for the worker to be transported. How on earth can you as an employer put the worker that you know could be seriously ill or is ill onto public transport and expose everyone else to this virus? This blows my mind, and I need someone to explain this one to me. Assess the risk of transmission, disinfect the area and the worker's workstation, undertake contact tracing, and refer those workers who may be at risk for screening, and take other measures to prevent possible transmission. Links to other legislation I've touched on. Now, one of the things that is happening, and the stories that I'm hearing about the UIF and the TERS fund and so on is also mind-blowing, because workers are being told that they've been given off and they are not going to get access to the funding that the minister made available for this this current situation that we find ourselves in, which obviously is of concern. However, should a worker have used up all their paid sick leave and they don't have any other leave available, the direction gives them access to the UIF side of things, known as the Temporary Employee Relief Scheme of the UIF, and they can make an application for this. Help the workers to access this as far as it is within your power to do so, rather than leaving the worker and to their own devices, who have families and they're basically being subjected to poverty, an unacceptable situation, of course. There's the other side with the stigmatization that relates to discrimination. This may not take place. And then, of course, lodge a claim for compensation if they are tested positive, and you are putting the incident report and so on. There is a claim for compensation that can take place. Diagnosed with COVID-19 and isolated. If a worker has been diagnosed and isolated in accordance with the Department of Health guidelines, an employer may only allow worker to return on the following conditions. So now the person has been diagnosed and everything, they've been off, under what conditions can they come back to work? Now here the direction gives you the information, and the same information must be given to the employees so that they don't act in ignorance, and that your workplace or your business suffers as a result of this. The worker has completed the mandatory 14 days of self-isolation. Can they return to work? Yes. In most cases, as you have seen by the recovery rate that is published on a daily basis, you will see that the recovery rate is far greater than the number of people that are dying as a result of COVID-19. Now, I don't speak with great pleasure that people are dying. However, such is the nature of such diseases, be it influenza and any other disease. Unfortunately, people do die. And do we know who those people are that are at greater risk? Yes, we do know. And can you do something about it? Yes, you can. So do it. Can they return to work? 14 days of self-isolation, the virus should have run its course according to science. Are there the outliers? Of course they are. Those are the ones that eventually land up in an ICU, become severely ill or critically ill, and in some cases they do recover fully and get well. In other cases, unfortunately, they don't. The worker has undergone a medical evaluation, not a test and so on. And this is one of the big changes that has been put in to confirm fitness to work if the worker had, take note, only if the worker was moderately or severely ill. So going to a medical practitioner is only when you're moderately or severely ill. No other occasion. Why are employers then still forcing workers to get tested and then penalizing them because the worker cannot return to work and therefore is seen as staying away from work? However, everyone knows because of this direction that the worker does not need to be tested a second time. In fact, the Department of Health protocols do not require a second test. The Department of Health specialists who sat on the NEDLAC committee drafting this legislation indicated as much, that this is sufficient to allow a worker to return to work because the science indicates as much. The worker has undergone a medical evaluation confirming fitness to work only and only if the worker had moderate or severe illness. Now, should you insist on this, employer or the employee representative, then you will be required to pay that anyway. This is not for the worker to pay for if you're insisting that the worker goes and gets this done at your own cost and not even at the medical cost or the medical aid cost of that worker. The employer ensures that personal hygiene, wearing a mask, social distancing, cough etiquette and everything is strictly adhered to by the worker on returning to work. This must be done. The worker will not just come back and not be under observation. They'll come back, you'll observe that they are, in fact, not regressing in this particular instance. The employer closely monitors the workers for symptoms on return to work, and the worker wears a surgical mask. Now, a worker has been in contact in the workplace with another worker who has been diagnosed positive. What must happen? Here you have the information, you have the direction. What do you do? If a worker has been in contact with in the workplace with another worker who has been diagnosed with COVID-19, the employer must assess that worker's exposure to ascertain whether the exposure carries a high or low risk of transmission between workers. If there's a low risk of exposure, the employer may permit the worker to continue working. So if there were two workers, but they were working far apart, you'll recall earlier on I said you'll close an area where someone tested positive. That area where someone tested positive and wherever else it may be required. Here you have a situation where a worker who worked a distance away from that worker who tested positive, who can continue, but they must be given the necessary PPE to continue, and then you will observe them over a period of time from the first contact that they may have had. Do they show the symptoms? Where the symptoms do manifest? That is important. If the symptoms don't manifest after a 14-day period, boom, you start on day 0, the person can continue, unless, of course, and here's the big problem. On a day-to-day basis, you do not know who people around you are getting into contact with. The contact may be a community-related contact. In other words, the person goes home and picks up the virus there, as opposed to at the workplace. So you have to monitor that worker's symptoms. If there's a high risk of exposure on the other hand, the worker must remain in quarantine for 14 days, and the employer of that worker must place the worker on sick leave and follow the procedures for such as well. So disinfection, then Department of Health has got a document, follow the document. Now, I don't know what the big magic issue here is around the disinfection. Please take note, you cannot use sanitizer to disinfect. That is not what we are looking at. Your disinfection can take place with other chemicals known to be used as a disinfection component. In this case, apparently bleach diluted in a certain quantity can be used as a disinfectant at the workplace. So who are you going to get to do this? You're going to get people who are sufficiently trained and have the right PPE to do the disinfection. All surfaces and equipment are disinfected before, and this is something that people are still not doing. Before work begins, periodically throughout the day, as well as at the end of the shift, workers are required to disinfect their working surfaces. In other areas, it will be people that you have employed as cleaners to clean those areas. All other areas that are known as common areas must also be disinfected and regularly cleaned. Disabling of biometric systems or making them COVID-proof is an important issue. Your biometric systems, where everyone again in a communal environment is required to put their hands and fingers and whatever, those areas must be disinfected. So someone who's coming to the workplace, if they go through a biometric station, they must be allowed to disinfect. That station must, during the course of the day, be disinfected. It will be a point of containment or cross-contamination. So you have to do what is required. And that is where making them COVID-19 proof comes from. So if you're not going to do that, disconnect it and allow people to use another method in order to monitor their coming and going. Right, so on this one, 36.4, workers interacting with public are instructed to sanitize their hands between each interaction. Surfaces that workers and members of the public come into contact with are routinely cleaned and disinfected. So we continue, we repeat ourselves, but the point is, are you going to do it? Those who you are going to speak with, are they going to do it? And the employer then, in terms of this direction, is told, monitor, monitor, monitor. Compliance officer, monitor. Cloth masks, the favorite one, of course, in the first one, this was a big issue. Thousands of masks in some workplaces, and employers said there's no ways that buying a washing machine, a tumble dryer, an iron, and whatever else. And workers, on the other hand, said they are not going to wear the mask of some other person. They want their own mask back, and so on and so on. So it was a logistical nightmare. So the direction changed in this instant. It says, employer, give your worker the masks. If a guideline comes up and it requires 4 masks, then you'll provide that as an employer, but it won't be less than 2. So in this case, you wear the mask to prevent yourself from becoming contaminated, and hopefully you're not wearing a crocheted mask. Wear a mask that is decent and will sufficiently assist you in keeping this virus at bay. Because if you breathe it in, you will obviously become sick. Now, some infected persons may not have symptoms or may not know they are infected. That we know, that's been around now for a while. The Department of Health requires that all persons wear cloth masks when in public. What did I say earlier? Department of Health is responsible for everyone in the country, but they are more specifically responsible for people within, outside of workplaces and so on, your public space, if you like. So they are giving advice. Even then, you must wear it. And you'll see certain businesses won't allow you into their workplaces, which is good because you're not complying with this. Every employer must provide every employee free of charge. We've covered, and so on and so on. Wear the stuff. Make sure it gets worn, and then your risk assessment will tell you how often you must change the mask, as well as the correct type of mask for your working environment. Where an RA indicates that a specific PPE must be worn, you will wear that. Make sure that it's the correct PPE. You cannot go in with a cloth mask into an ICU. You will get sick for obvious reasons. Don't go even into hospital with a cloth mask. And this one over here, this one really got to me. Depending on what is reasonably practical, given the nature of the workplace contemplated, every employer must determine the floor area of the workplace in square meters to determine the number of customers and workers that may be inside the workplace at any one time with adequate space. Now, we all know we're all landing up in queues when we go out to the shops and so on and so on. If you go there with your partner, in some shops, they won't even allow you with a partner. In one shop yesterday, one retailer said, you will take a trolley and your partner will take a trolley. So we had to go with 2 trolleys, even though we only needed 1. Comply with it. Leave it like that. They are trying their best to make sure that this virus and the disease is contained. You must note then a range of workplaces to ensure that there's the distances, the physical barriers, and then also, and this one is something you must take note of. If you don't take note of this, you're going to have a bit of a problem. If appropriate, undertake symptom screening measures are persons other than its employees entering the workplace with due regard to available technology and any guidelines issued by the Department of Health. So you find, now the other day someone sent an email through to another one and CC'd me on the message and said, I have to rub this temperature scanning device, I have to rub it and knock it in order for it to work properly. Are you out of your mind? That is not an appropriate device. You pay for something that you should never have bought in to start with. So get decent equipment if you're going to do the screening, and take note of this. Undertake the symptom screening measures of persons other than its employees entering the workplace, if appropriate. So my focus for today then is the following as we head deep into this chasm or stand on the edge of the crevasse and ponder our current position in the COVID wilderness of unknowns. The unknowns are many people are claiming to know enough about the virus, and in my opinion, still don't know enough for us to be able to say that we have arrived and this thing is going to disappear totally. Refusal to work is the other newbie that has been added, and probably something that we are going to see workers starting to take into their own hands. If the employer is not doing what is required to do, the worker is going to resort to this as a last measure in relation to the employers not listening. So an employee may refuse to perform any work if circumstances arise which, with reasonable justification, which incidentally you as an employee must take note. You will need to prove what that reasonable justification was, and I'll tell you where that will happen. With reasonable justification, appear that employee or to a health and safety representative pose an imminent and serious risk of the exposure to COVID-19. And you'll recall early on that there was a group of 4 people that matters can be addressed to. In this case here, I'm going to repeat it because it's that important. An employee may refuse to perform any work if circumstances arise which with reasonable justification appear that the employee or appear to that employee or to a health and safety rep to pose an imminent and serious risk of the exposure to COVID-19. What's happening now is we are being inundated as inspectors with complaints where it is clear that there's danger at the workplace. We have to go out and prohibit further activity of that employer because the employer is refusing to take note of what is happening in his or her workplace. Well, now you've got a problem. The workers can leave your workplace. You can threaten them and everything else. Let's see what happens if you do that. An employer who has refused to perform work must notify the employee either personally or through a health and safety rep of the refusal and reason for the refusal. Every employer must, after consultation with the compliance officer and any health and safety committee where one exists, endeavor to resolve any issue that may arise. Can we read that one again? Because this one is spot on. The employer must endeavor to resolve any issue that may arise. And we are going to look for that proof. We are going to look where the decision was made. And I'll tell you why it's important in a moment. No employer may make any deduction from any employee's remuneration who refuse to continue working. No person may threaten to take any action against a person because that person has exercised or intends to exercise the right to leave the workplace. No employee may be dismissed, disciplined, prejudiced, or harassed for refusing to perform any work. Wow. Take a step back, because where we are heading to at the moment this downward slope that I've been talking about, where in the beginning it was like this, where we are now, we are in the middle of it. We are engaging in a war. And how do we engage and win this battle for now? Even if you talk about a second wave, how do we beat this battle? So you cannot do anything to a worker who indicates to you that they are not going to continue working, and you've done all the other issues that we have spoken about a moment ago. Now, here's the thing. If this matter goes to the CCMA, and the employee can go to the CCMA or to the bargaining council, then that matter, that commissioner is going to request all the evidence that has been spoken about in the last few clauses. Where is that evidence? And if there's no evidence, the employee will walk away having taken the employer to task for the reasons given. The arbitrator then, if the arbitrator appointed to determine a dispute finds that the employer has contravened, the arbitrator may make any appropriate order. So you can see this matter is not just going to fly away or disappear. Workers can now stand up for their rights and they will be protected. And this matter, if it goes to court and it can, and the employer hasn't done what is required, the workers will walk away with a decision in their corner. So as many currently draw our attention to the mirage of cures, that is, this will cure, that will cure, we found the cure, and so on and so on. For now, all of that is a shot in the wilderness. Everyone's got a cure. I've got the cure. Make sure that you do everything that is required in this direction in order to ensure that you stay clear. COVID can be beaten, but, and as I get to the end of my presentation, let's spread the message, not the virus. Spread the message. This is what you need to do, not the virus, by going out and not doing everything you're required to do. We can beat this. This battle can be won. What role are you playing, or are you a spreader? What is your takeaway for today from this message? And that particular note is from my supervisor, Ms. Moilwa, is the Inspector General. And I'd like to thank you, CEO of SIOS, Mr. Norkia. Thank you to you and your team for the opportunity. I did appreciate the time that you afforded me. A totally different environment. I normally like the face-to-face, but this has really been great. Thank you.
Thank you, Mr. Zana. Much appreciated. A very comprehensive presentation, much more than we anticipated. So we appreciate it for preparing it and for delivering this presentation to us. If I could ask you, Mr. Zana, to just remain on with your camera and your sound on. We do have, unfortunately, hundreds of questions, which is impossible to answer now. So just a note to all the attendees at the moment. I think it was posted at one stage that it's humanly impossible to go through all those questions. We had a panel of people in the background by the name of Garth Hunter from NGen, a chartered member of SIOS, as well as Sean Chester, another chartered member of SIOS, that tried to answer as much of the questions as possible. We have asked Garth Hunter, if I can maybe ask him to come on at the moment to share his camera with us, to look at some of those questions and collate some of them, and maybe if we can ask you, Chief Inspector, if you can maybe try and answer one or two of these questions, we will really appreciate it. If I can also ask, with your permission, if we can collate the related questions and perhaps send it through to your department. If there is time permitted, some of your senior officials might be able to dot down the appropriate answer, and maybe we can post it back on the SIOS website, because we will not be able to go through all of them. If that's okay with you, sir.
I would appreciate that, Mr. Nakia.
Thank you. Right, Garth, are you there in the background?
I'm here. Can everyone hear me?
Yes, thank you. Thanks, Garth. Right.
Okay.
So you got this tedious task now There was in excess of 200 questions. Some 65 of them were answered online. Can you collate the balance of the 148 questions and maybe compile them into 5 or 10 pertinent questions and pose it to the Chief Inspector? Thanks, Garth.
Sure. Afternoon, Thibault. How are you?
Garth, I'm good. Thank you, man. Good to see you
Good.
again.
Likewise. So what I've done is I've taken the questions and collated them into some themes. And for example, the masks I've created in a theme and some other questions. So if we start off with then a question, does the department have a hotline for reporting employers that are violating the directions?
Thank you very much, Garth, and I would prefer it if we take them one by one. Thanks. The reporting of these issues must go to, and we have the details online, to the provincial chief inspectors, as well as the occupational health and safety specialist. There is one of each in each province, and they are responsible for health and safety related matters. Alternatively, and this must be really on the outer, where they can send me a WhatsApp and I'll respond to that. I respond as far as I can to all my WhatsApps, but please don't say hi to me and then that's the end of the issue. State your question so that I can respond to it immediately. I get into discussions with people on WhatsApp, which I'm not going to do going forward. So thank you for that, Garth.
Yeah, I'd suggest that that's quite a limited offer for really serious issues. So the next question relates to, I know we've had this question, if an employee gets hurt at home, is that an IOD?
No, the compensation fund doesn't recognize it. And as far as we're concerned, you're in control. It is still a private household. If you give people the option of where they want to work, at home or at work, they're going to tell you at home. You see that in the presentation I did, it talks about a risk assessment, and it does say that the employee has to monitor, but you are there on a you are there all the time. Make sure that your workplace is in a safe state and that there's no chance of you getting injured there. But what I'm quoting is from the compensation fund. They do not cover people at home in relation to claims.
Then another government related question is that, as the DOEL, is that if another government organization, they're transgressing these directions, what's your take on that? How do you deal with that?
Thus, we have served many prohibition notices. We've had threats of court action and everything. We do deal with matters related to employers. We don't deal with this employee in this sector, not that one in that sector. We deal with government employers, and we're dealing with workers who have a right to be protected, and we act without fear or favor. My job in terms of the act is to make sure that everyone is healthy and safe in their workplace environments. So if Mr. Nokia is not making sure you're safe, let me know, Garth, I'll deal with it.
Okay, sure. Then a question you mentioned, Mr. Nokia, is SIOSH and SIO, is any thinking for the department to use the services of professional bodies? Because it's such a huge, unprecedented crisis and pandemic that, I mean, the resources are not what we typically need. It's just scaled up.
I think, where we've been thrown into over this last couple of months, we have seen an interesting development, if you like. I mean, I've seen even my own people on SIOSH websites, so I'm getting a bit worried who they're working for. I'm also not today on SIOSH. But jokes aside, professional registration is a key issue. And what we need, and this is where the problem comes in, we need health and safety bodies, because there's always going to be someone out there who wants to start something, but recognized health and safety bodies representing those health and safety professionals. I mean, you choose where you want to go. There was ISM, people were at ISM, they went over to SIOSH. SIOSH and built up its own membership over the years. You have other health and safety bodies that want to kick in as well. And we know this happens. So what we'd like to do is we'd like to recognize health and safety professionals. And I think 2-3 years ago, at a conference probably that I attended, a SIOS one in Midrand, Gallagher Estate, this issue came up where I indicated that is my desire over the last several years, that we need to professionalize this industry. A couple of years ago, probably almost a decade now, the Nigerian to professionalize, and why I mentioned them is we're in Africa. We need to push the African agenda in terms of health and safety professionals under the African Union. So this is something that needs to get greater attention. And I think where we are now, we need to sit around the table, all the health and safety professionals, in order to pave the way forward for the next 10 years, in order to make sure when we face these sort of crises, we face it together. So let's join our forces, as SIOS has done in this instance.
Okay. And then another question was that relates to employees, because the focus clearly on the employer's responsibilities, and correctly so. But if you, after you've issued training, you've given the masks, you've trained, you've informed, you've got signage, and the guy or girl actually walks around with their nose sticking out or wearing it as either a head warmer or a neck warmer, can you discipline employees in terms of the directive? And what's the legal standing of the directive in relation to that?
Garth, I think that's a very important question. And when I started the presentation and spoke through it, I indicated that the Health and Safety Act does not fall away. So Section 14 is always there. Section 14 is the employee's duty and responsibility not to endanger, and I'm using loose words here, not to endanger their own lives, not to endanger the lives of those around them. So if during an investigation, we find that both the employer and the employee could be held responsible for not doing what is required, and by either causing the death of someone else or causing them to become sick, we obviously, these will be test cases. We'll see how they pan out, but you may not endanger your own life or that of others around you. So you could be taken to task from a legislative point, specifically, not even your employer, for failing to do what you're required to do.
All right. And then moving on to masks, some questions, I guess that was interrelated. And these are some questions I've also been battling with as a hygienist to guide on. Not such easy questions, but can a face shield be used instead of a face mask in a low risk work area?
I think that is a very, very good question. Now, if you ask me, can that happen? And this was one of the questions one of the inspectors asked the other day. I'm saying to you, in a low risk environment, yes, no problem. But we are also led to believe that the science says that the majority of the particles available in that environment should have gone to settle down. So you will be dealing more with surface issues. And I think you touched on this the other day. You're faced with other situations which are slightly more problematic, and you will understand that for me to give you one blanket answer means that I understand every single environment. So if you are in an environment where it's a closed environment, and you know that one of the requirements is that you have some airflow here, then you need to look at all the aspects, do the risk assessment. Can I get away with it in an environment where there are few people and it's me and someone else in an office? Do we need to? No, you don't. You see how simple it is. Now you make the environment a lot more complex. We go to the retail store. Your distances there are far less, and the direction touched on this as well. You have air conditioning that is in a certain way, and so on and so on. Things that exacerbate. In other words, you do your risk assessment. You look at your environment and say, this is creating a problem. That's great. There are too many problems. The variables here mean that I need to provide a face mask, a face shield, and you go haywire. Put the person in a bag if you have to. You see where I'm going to with this. So look at your work environment. And I like the term used, low risk versus high risk. So the moment you move to a more high risk environment, you are looking at a bit more of the PPE requirements playing itself out. So I would hate it, Garth, if any health and safety professional gave one answer to this question, because it's not that simple. So low risk, you can get away with a face shield, but the moment you go out of that office and you're walking around, and you are more than likely going to bump into people and speak to them. The more noisy it is, you know how it goes, you're going to move closer together, and now you start interacting in each other's spaces. And all of us knows the closer, the higher the rate of contracting this virus, the further away you are, the less the chances are. I've taken the long way, guys, but did I answer your question?
So, for example, if somebody is then
Around them, do they also required to then wear face masks?
Garth, you broke up there. Just repeat it, please.
Garth, there's something wrong with your sound. Can you just repeat that question, please?
Okay, sure. If an artisan is working alone, for example, they don't have anybody around them, or you're in your office alone, would you still be required to wear a face mask?
No. I entered an office the other day, or a room. In that room, everyone was wearing a face mask. I took mine off because I had to speak with them. I didn't feel endangered there. I evaluated the environment, and I said that to my people. I've evaluated it. So what you need to do then is you have to evaluate every single situation and determine what your level of risk is in relation to you contracting the virus within that environment. So my answer to you is, I don't wear one in my office. I don't feel I need to. It's not going to jump off my desk onto my face and into my lungs, if I can put it to you that way.
Okay. Thanks, Thibault. So the next question is that relating to the use of manual handling. If you're lifting actually an object which requires 2 men to be, and you can't maintain your social distancing, do you have to use a mask there? Would the cloth mask be sufficient?
Wear a mask determined if the person had been in contact. You'll remember what we said early on. People who had low risk contact with other people can be allowed back into the workplace. They must wear the mask. Now, the type of mask you're going to wear, again, I said early on, don't wear crocheted mask. You're going to have to make sure that you wear a good mask, a mask that you know will protect you within the environment in which you are going to work. What is that mask? Of course, you're not necessarily and don't need to go for an N95 unless you are working in a hospital environment and you're now in the ICU and you are moving things around, as opposed to within a normal work environment, a factory environment, if you like.
But then moving to some medical questions, what can be done to prevent the abuse of sick leave if employees are requested to work, but they choose not to work if they have cold or flu-like symptoms and they've been tested COVID-19 negative?
God, this is a difficult one, and you knew you were throwing me a curveball on this one. So
I did.
CEO, you need to call him to order. But listen, on a serious note, this one, when I had this question yesterday as well, it is very difficult for me to answer that one. And the employer obviously knows the workers, those that are chances and those that are not. And I'm being a bit open on this issue. You know your workers, do what you're required to do. I cannot give you a definitive answer on that because we are dealing with people.
Garth, while you're just quickly looking at the next question before this one maybe slips away, and I know we're taking a lot of time, Thibault, we read in the media that some of the Department of Employment and Labour office has been closed, positive cases been identified. in those cases, on those offices, are your inspectors still in the field? Are they still active, or are they also at home?
Out of the inspectors that have been out in the field, as I indicated earlier on, since the 27th of March, they've done more than 4,000 inspections at the workplace, the 170 odd. So they, out of all the cases, I'm aware of only one case. Those offices that were closed could have been a community infection. It could have been in-office infection. What I do know is the Department of Employment and Labour delayed opening to ensure that everything was in place. In some cases, some of the people were working in the background, not getting exposed from, from the front office. And there would have been someone that visited, that would have gone to, do something and came back and unfortunately tested positive at that stage. So out of all my inspectors, I believe only one has apparently tested positive, if I'm not mistaken. So that is out of all the days that we've been in lockdown, Mr. Nokia.
Thank you, Thibaut. So just to confirm then, from a reporting point of view, where the employee have to report a positive case to the provincial inspector, chief inspector, that is still in place. The contact is there, and the various provincial chief inspectors will field that call or that message.
Yeah, www.labour.gov.za. That's the Department of Labour. And if you don't get hold of them, you can go to their supervisor, who is the Chief Director Provincial Operations. There's one in every province, and they head up the offices of the Department of Employment and Labour in that province.
Thank you. Garth, have you got perhaps another question?
Yes. Then if somebody is over 60 years old, does it mean that the person is considered vulnerable? Or is it 60 years old plus some other risk factor? For example, if the person is 60 and they had diabetes.
Thank you, Garth. I think the definition that I read out a couple of times earlier indicated very clearly that someone that is older than 60 is deemed to be a, what is it called? A vulnerable worker. So very definitely someone in that category is a vulnerable worker. If they have additional issues, comorbidities and so on, then it increases their level of risk so much more, which means that the employer, if the employer cannot guarantee their health and safety at the workplace, they should rather consider having that person work from home. But in the case of vulnerable workers anyway, the direction is saying, Mr. or Miss Employer, please consider allowing these people to work from home.
All right. And then I guess it's in the same vein, also the medical vein, is that you spoke of infections and finding out where the infection took place. How is that possible when to find out whether the infection took place at the workplace or actually it took place actually the community? Because it's often difficult to figure out where you can't see this virus. You can't understand necessarily whether the person's been in the workplace and been in contact with somebody. Do you have any tips or guidance on that?
Yeah, obviously this is one of those difficult ones again, but very simply, one of the tests is nobody at the workplace that you're aware of. And when you do your screening, remember now you do your daily screening. If nobody's showing any signs, then generally speaking, you should not be having an infection prevalent there. However, we're all aware of those that don't show the signs and so on, the asymptomatic group. But let's say that they're clean, then you know that you don't have it at the workplace, right? Now, one person picks it up at the workplace, you don't go through the measures that we've indicated in the direction. You're more than likely to have someone within the next 3 to 4 days, plus or minus, starting to show symptoms at your workplace, which means they most likely picked it up there, especially if nobody at their homes are infected. So there was a woman who went to work. And her colleagues were very worried that she would in fact pass it on to them. They found out that her whole family had tested positive, and days later, only when she got her results did they find out she too was positive. Now, when we go back to taking out the stigmatization, we're talking to an employee-employee relationship that is good, then you'll find that workers are going to be open to you. When you are not doing that and you're keeping away your UI funding, you're doing this and that, there's no trust there. And you threaten the employees, then you are going to find a situation that workers are going to keep quiet, and you eventually sit with the whole workforce that is sick, because you're saying you will be fired if you don't come to work. What is a worker going to do? They're going to come to work, Carl. So we're left with an environment that employers are creating. They can create a different environment, bar the fact that you do get the odd employee that obviously will test the system.
Yeah. So speaking of then employee relationships, it says the one question is that, speaking about vulnerable workers, the first question is, how do we accommodate vulnerable employees? For example, somebody's over 60 and they can't do work from the workplace. They can't do work from home. Can they spend the next perhaps year staying at home and you pay them?
Well, that's a very, very good question. I haven't got the answer for that one, I'm afraid.
And so the next one, let me answer the next question, is that, which is attached to that, is, can an employee retrench a vulnerable employee because, for example, they're over 60 and have to be at home, they can't work for then a year?
Another good one that I also got, if for operational reasons it is deemed necessary, then the employer has to decide on that matter. Of course, if the employee feels that it's unfair, they can go to the CCMA and so on and so on. So in the current environment, we're going to have some test cases that are going to run its course.
Yeah, I know. Speaking personally, I think that it was quite easy we thought that we could see what was going to happen. Things seemed quite straightforward, but now we're actually in the thick of things. Things aren't that straightforward, and we're having to really deal with a lot of complexity. And sometimes it's only through things working themselves out that those actually the answers will actually become evident, I guess. And some maybe there will be no good answers because it's naturally difficult.
Can I say at the same time, such webinars that elicit the responses that you're getting, or the questions and so on, who knows what the third direction might be like. So some of these things could be incorporated. So it's important that we talk to one another and take note of what's happening in order to feed in to the forums. Mr. Nokia, for example, sat on the NetLake forum, so he's aware that how these things operate, and that such information becomes critical to making sure that we don't milk the system, but that we learn from it and develop appropriate systems going forward.
And then another question relates to, you have so many government departments, almost, I'd say unprecedented, where you're both developing legislation as well as then having to enforce across different sectors. And government department, speaking as an ex-Department of Labor actually inspector, is that you always had some difficulties with mandate. And here you have entirely overlapping mandate. And there's been quite a few questions around, how do people then, if you've had an inspection done by one actually department, does that actually then mean that another department can actually come in and actually give a conflicting view? Or how do you actually deal with, what's your advice for employers to deal with overlapping mandate between other departments in the workplace?
Yeah,
and also the different requirements required by them.
My first port of call is go to the department that you know of. If there is something, like for example, I had a query this morning from a woman on behalf of her husband. I said to her, unfortunately, I can't assist. I'm aware that the DMR, the Department of Mineral Resources and Energy has got its own direction. I had to refer there. She then asked me for a number, I gave the number. So this is what I do from my side. Otherwise, there are other fora that I can take matters up and deal with issues.
I'm just going to finish off with two questions on cleaning. Is that, and there's quite a few questions on cleaning. I mean, we've never had to clean. People are not familiar with cleaning, the difference between sanitizing, disinfecting, decontaminating. And there's a lot of questions around this and a lot of uncertainty around this. Companies ask, can companies do their own deep cleanings with the correct chemicals?
My opinion on this matter, and this is my opinion on the matter, is firstly go to the Department of Health website and go and have a look at what they are talking about in terms of decontamination and all that. Make sure you comply with it. In this direction, they mention something shortly there, but they don't go into greater detail. They refer you back to that document. So I'm inclined to say to you, go there first. What we're finding though, and this is of concern, when an inspector goes in and asks questions of people, even in an environment that you expect people to know, cleaners to know, the cleaners themselves don't even know what decontamination is, despite them working in an environment that they should know. So we are left with employers that are not, and I say employers, the employers and the senior management of the organization not properly managing this thing. So if you know your cleaners are not geared to do this, do not send them in, because you are going to be creating an environment where they're going to come away with other illnesses, and so on and so on. You take, okay, I'm not going to go into the details, suffice it to say, go to the Department of Health website, check out on it. But to answer your question, this direction doesn't talk to that. However, the risk assessment is clear in terms of cleaning up and all that kind of stuff, what must happen. Remember, the direction said, if there was someone ill in an area, go and decontaminate that area, work there. You know what
I think the one point you've made is that the act as well as then the regulations still apply. So in the HBA regs, they've actually then, it's quite detailed requirements for training there. And so those training requirements are actually still have application in relation to COVID-19.
Absolutely. So you find inspectors are serving prohibition notices and the employees want to know why. Guess why? It's because you're allowing workers to do things that we don't allow in health and safety.
Okay.
Arthur, sorry to interrupt.
Yes.
I'm sure that you're getting towards the end. We are heading for nearly 2 hours now.
Last
If there is
question.
still a couple of questions. Oh, that's good timing. Maybe the last question I was going to say. Possibly. Thanks.
So it's just we'll finish off just with the disinfection question. Is that does the disinfection have to be done by a registered cleaning company? I mean, we've seen people who perhaps used to do whatever. I'm not sure. But there's all these cleaning companies actually popping up. Some of them, I don't think know too much about cleaning, but they're certainly putting themselves out there. Is there any registration actually required? And is a certificate actually required in order to actually say that actually a workplace has been decontaminated?
I'm going to answer the question. So there are two issues here. One I covered in the presentation, which said disinfect the area of the worker and any other area that is required. That does not call for a specialist or specialized cleaning company or whatever you want to call them. Very simply, and you will know this, if the legislation calls for something, you follow that. If it does not call for it, you do not need it. It doesn't matter what an inspector says. It doesn't matter what I say. If it's not in the legislation, you do not do it. So to emphasize what you've raised, it's not in the direction as it stands. However, go back to the Department of Health document, the guidelines that we should, and just confirm there as well, because the direction refers to the Department of Health document. I just want to put that into context. Not written, no need. Written, comply fully. Garth.
Okay. Well, thank you. I'm going to
Okay.
hand over to Niels now. Thank you so
Thank you.
much.
Thank you, Garth. Right, in closing, can I just maybe summarize and then close the webinar? First and foremost, Mr. Zana, thank you very much for your time. I do not believe that on any other platform we would have got such a detailed and precise presentation, even at our annual conferences where you used to speak. I mean, your time was limited to about 45 minutes. Here we're heading for nearly 2 hours. We really appreciate your time. We really appreciate the effort that you've put in, and also taking the time out to answer some of these pertinent questions. Also, thank you to Garth in the background that monitored all the questions, and also to Sean Chester that also answered some of the questions online for us today, as per our other previous webinars. Also, thank you to Gareth, our communications and membership manager in the background, that made sure that everything worked smooth and all the connections were running fine. Just a quick reminder before closing then, just a reminder to our SIOS members that this webinar is CPD verified by SIOS with 2 CPD points. I've explained how you can claim your points. Just also a reminder that it was recorded. I saw some members only popped in about 2 minutes before the end, so please, you'll have to go and watch the recording again before you claim the 2 CPD points. Please also have a look out for our next webinars. We thought we're going to have about 3 or 4 or 5 of these. We're now on number 8. We've already got other specialists lined up with interesting topics, and as this virus or the knowledge develops and directions change, we will continue to deliver these webinars to our members. We're reaching more members at the moment with this SIOS webinars than we've ever done through our workshops and our conferences. So please stay tuned and have a look out for the next ones. I just want to close off also by saying, I think, Mr. Zana, you hit the nail on the head there. You know, we as safety fraternity, we take normally legislation and we pull it to part, and must and may and shall and maybe. And I think what you said at the end there is such a great way to end this webinar. If it's not in the legislation or if it's not in the directive, well, don't go and generate it. Don't go and say that somewhere there must be a certificate or a competent person or a qualification or whatever the case would be. So in closing then, thank you very much to everyone that participated today. We really appreciate it. Timo, once again, great. Thank you very much. And thank you for taking my calls late at night and making sure that my nerves is still there, because, you know, when you set up a webinar with this magnitude of the size, where we had over 1,200 persons registered and live streaming on YouTube, you know, I literally can't sleep the day before. I really appreciate your participation. Thanks to our members. Until we see you next time, keep safe, and if you can, stay at home. Thank you.